Thank you, everybody who is joining us today. There's lots of faces from Health Innovation West of England, but there's a couple of faces who are not from the HIN. And today we're going to be talking about real world evaluation and giving you an introduction to what we mean by real world evaluation. This is part of a webinar series, so we're planning to run a few webinars. So we'll share the date of the next webinar at the end of the presentation. For all people who I've not met before, my name's Ruth Barker and I'm the Senior Insights Manager in the Evaluation and Insights team. There are many of my colleagues who are on the call today, so I do invite you guys also to chip in, Mairead, Vivi, from the Insights team if there's things when we have a conversation that you'd like to add to that. What I will say as well is as we go through the slides, please just ask questions as we go, either pop your hand up or type them in the chat. I'm really happy to take questions as we're going through rather than wait for everything at the end. I am planning to do the presentation, but then a Q&A at the end as well. So if you do want to hold a question to the end, by all means do that as well. There is time ring fenced at the end of the presentation. Vivi, can we have the next slide, please? So before we get into the topic of today, I know there's some external faces, so I really just wanted to spend a minute just giving people a bit of a background of who we are. So the Health Innovation Networks were previously known as the Academic Health Science Networks, and there's 15 of us across the UK. Vivi, can you just tap on a couple of times just to bring up the visuals? Perfect. One more, that's great. And our role is essentially the innovation arm of the NHS. You'll see the map of the UK, the representation of where the 15 HINs all sit. And particularly for the West of England HIN, we have a regional focus. And you can see that we know the ICB borders have moved and changed slightly, but this is how we support our local health and social care system. And I won't go into lots of detail today around kind of the work that we do specifically within the HIN. But if you are interested, you can go to the website, or there is a QR code on the slides that will be shared afterwards that you can scan to go and have a look at the work that we do. So essentially today, the session objective is to start to think about answering the following question. So what evidence and evaluation is required to be successful in the NHS? So if we move on to the next slide, thank you, Vivi. Today, the plan is to talk about what is real world evaluation, why we do real world evaluation, and the practicalities of how we might do that. So next slide, please, Vivi. So starting with what is real world evaluation. So next slide, please. Real world evaluation is essentially posing a question in a real world environment to really understand either does an innovation, a new way of working, a new model of care, a new role, does it work? Another question you might pose is why and how does the innovation, new way of working, intervention work? And actually, is it worth it? So economically, financially, is it worth doing the thing? So they're the three key questions we might want to pose when we're thinking about in the real world, in the setting and the sector or the system that we work in our context. That's the evidence we want to understand. And so the why do we do a real world evaluation? So next slide again, Vivi, please. You know, there's key reasons why we might do it, and we come at this from slightly different viewpoints potentially, but essentially we probably want to provide some evidence to the value proposition and the business case around the innovation, the model of care, the new way of working. We probably want to demonstrate some impact of what it is that we are innovating, the thing that we're doing new, that's changing, for the commissioners who are going to essentially be the people who are procuring the thing if it's new, or to evidence why we want to continue them to procure the thing that we want to do. We want them that we've developed, or we might be wanting to learn and generate some understanding to improve the intervention or the innovation. So there's a few key reasons why we might do real world evaluation. And so when we think about these things, we want to be thinking about, things like people might be making a significant investment. So we need to evidence that we need that evidence to demonstrate a business case, why it might be valuable. If something's novel or innovative, we might need to be thinking about, well, if we're going to improve this or we're going to get this commissioned, how do we do this? What learning do we need? What evidence do we need to be able to do that? So there's a few reasons why we might do real world evaluation. Maybe next slide, please. And so I haven't lingered too long on that because I wanted to kind of come into the how. I think most of us know why we do real world evaluation. But actually it's the how that tends to be the most tricky bit. So that's kind of where I'm hoping to spend most of the time today. So Vivi, next slide, please. So I mentioned earlier that these kind of three key questions that we tend to ask. So the does it work? And in evaluation terms, we tend to call these impact evaluations. And I'll talk about each of these types of evaluations separately. And when we talk about why and how does something work, that tends to be what we call a process evaluation. And then when we're talking about, is it worth it? So what, if we're putting money into something, if we're financially going to invest in something, is it worth it? And that's what we call an economic evaluation. And across this spectrum of impact, process and economic evaluations, we can also do things called summative and formative evaluations. So again, I'm going to come back to these terms, but essentially this is how we would frame them and how we would be, when we're talking about evaluation, this is the sort of language we would be using. So if we can start with impact evaluation, so answering that question of does it work? Does it do what we think it should do? So next slide, please, Vivi. When we're thinking about demonstrating impact, we quite often think about this hierarchy of evidence. So research, when we think about research, it spans quite a lot of this hierarchy of evidence. So for example, randomized control trials, they're always going to be research, just inherently in the way that they're designed. Real world evaluation, the types of design that we might have in an impact evaluation might be something, a quasi-experimental study. So a study where we have a control intervention and a comparison group, but they're not done through random allocation. So that could still be considered a design that we would use for real world evaluation. And again, we might have cohort studies where we don't have a comparison group as a design within an impact evaluation. That can also be seen as a research methodology, but we might apply that in the evaluation space. Again, thinking about qualitative or descriptive studies, again, that might be something that we do in the real world evaluation space as part of an impact evaluation, as well as it being a research methodology. So I think I'm not going to linger again too long on this, but I think it's just being aware what types of methodologies might we consider applying within a real world evaluation, and actually what would potentially always be a research study where you would be looking at some of the processes might look slightly different. And I think Mairead, please jump in as well here if you would like to. But I think the key thing for me when I think about the hierarchy of evidence, when we're thinking about real world evaluation and generating evidence for the sort of the pragmatic space that we work in, I think it's about that. I think it's about being pragmatic, and we don't always have to generate randomized control data from randomized controlled trials for it to be useful for us to be able to make decisions off. I think it's about doing the best study and project that we can do and doing it in the most robust way that we can do for that project. It's not necessarily about, being as high up that hierarchy of evidence as we can be. It's about being really deliberative and being really considered about the choices that we make. So next slide, please. I think I've just touched on this a little bit, but it's just, as I say, that deliberative, that thinking about what choices you're making in terms of the methodology you might choose to apply within an impact evaluation. one size doesn't fit all. You're not going to do a quasi-experimental impact evaluation for everything that we evaluate. Similarly, we're not going to do a qualitative or a descriptive study for every innovation that we evaluate. So, as I say, it's been really considered about what do you need in terms of the evidence, how do you need to generate it, and being really thoughtful. Key thing to do is ask people who are going to be commissioning the innovation. So if you know what the commissioners need in terms of evidence, that will help drive and guide what type of impact evaluation methodology you might apply. So if your commissioner really wants to understand how your innovation is going to impact patient experience, for example, as well as patient outcomes, you might have a more qualitative focused evaluation. Whereas if your commissioners are asking for impact around, say, for example, health related quality of life, and they need it evidenced and measured in a certain way, you might have a different focus for your impact evaluation, and they might want to understand how is it changing, what does the service look like now in terms of outcomes before and after. So you need to just potentially be having those conversations to really understand what the need and the ask is. I think the other thing to think about is it also depends on the stage of the innovation as to what you might be considering in terms of the level of evidence. And just to flag, there are nice guidelines available for digital technology. So there is a link on the slide. So again, it's probably worth having a look at what guidance is available as to what types of evidence you might want to be generating for the innovation that you are developing. So there is specific guidance around digital technologies. So it's worth having a look at that. So you're really being considered and deliberative about the type of evidence that you're generating within that impact evaluation. So next slide, please. And so when we think about evaluating impact, the key thing here is to start with the problem that you're trying to solve. So generally, you want to think about what problems are you seeking to address and for who. And quite often this is split out into the people. So people could be your patients. If you work in social care, it might be residents or clients. It might be family members or carers. It might, your people are key stakeholders who are potentially users of your system, of your innovation, those people who you're looking to feel that impact or see that impact on. Staff and organisations, that might be separated out into two. You might have the staff using, for example, the innovation, and then also at an organisational level might be looking at different impacts. So being really clear about who your potential stakeholders are, who you think might be impacted by the innovation, and who it is you need to demonstrate impact on for this evidence to demonstrate the value of the thing that you've designed or looking to be commissioned. And again, systems, depending on what level you're anticipating the impact happening at, you might be looking at a system-wide impact as well. So again, just having a think about what is the problem at a system level that you're looking to solve, and then doing that thinking up front about the problem and who it's attempting to be this thing is attempting to be a solution for. You can then work that into a theory of change. So essentially a theory of change is saying, by doing these people and within this system doing these activities, we will see this output, which will give us these outcomes and these impacts. And so what it helps tell that story essentially of what mechanistically is driving that change. What behaviors are you looking to change in terms of getting to that point in order to be able to demonstrate those outcomes and those impacts, and making sure you're really clear on that process, so that when you start to then measure the impact, you're actually measuring impacts that are achievable by delivering the activities that you're planning to do. there's always this inherent risk that if you haven't mapped out this theory of change up front and fairly early, you make some big assumptions that by doing these activities, we're going to see these outcomes and these impacts, which actually, if you'd mapped it, you would have, you might have had visibility on, well, actually, we're not going to be able to do it. That won't achieve that. That's not going to be possible. And actually be able to either problem solve some of the barriers or the things that are going to cause, that you are able to preempt potential issues or blockers, for example. Or actually, if you identify some really key facilitators by doing this in a more systematic way, or this work, we think this might be a thing that might facilitate this to happen in a better way, you can kind of amplify the things that you think might work well to get the best impact that you can see. So it does help just illuminate some of those things. It also helps you identify things like unintended consequences within that, thinking about theory of change. So if I change this thing here and I intend to have an impact here, is there a potential unintended impact somewhere else in, say, the system? So if you change something in primary care to improve primary care processes, does that mean more people go to A&E? So there's a higher burden, for example, on A&E. So are there other things you might have to measure to make sure that the benefits and in terms of the impacts that you see in one part of the system, they're not having a negative consequence or a disbenefit somewhere else? So it's just, again, the theory of change helps to illuminate some of those things. And then from there, you would then design what we call a measurement frame. And it's essentially saying, I've got this outcome, I'm going to measure it in this way using this questionnaire or by collecting data on this thing. And these are the people who own this data, or this is how I'm going to collect this data. Again, being really clear up front about your measurement framework means that you reduce the risk of having things like missing data, or getting to a point where you realize the data doesn't exist that you thought did exist, then you can't demonstrate the impact that you maybe considered being a key impact, which then you don't generate the evidence that you maybe anticipated. So that's a bit of a whistle-stop tour about impact evaluation. As I say, there's time for Q&A at the end, so if people have any questions, I'm happy to come back to bits. So Vivi, can I have next slide, please? So the next part I'm going to talk through is process evaluations. So that's thinking about why and how does the thing work. So next slide, please, Vivi. A bit like the other slide, I'm going to linger on this slide a little bit longer just to talk through. I appreciate it's quite busy. So essentially with process evaluations, what we want to do is, where it's got that context box, what we really want to do is at the beginning of a process evaluation, or when we're thinking about a process evaluation, we want to be describing the context in which we're doing the thing. So what does a system look like in which we're implementing the innovation? What's the population that we're implementing the innovation with? How prevalent is that in terms of, say, the system, the particular ICB, that particular acute trust, that local authority? So really put some depth and breadth to the context. And that runs throughout the life cycle of process evaluation. So we know things change over time. Politically things change, new guidance comes out. So again, you don't have to see the context as this static thing. Your context is something that you can be constantly thinking about, so that when you actually come to think about your process evaluation at the end of the evaluation, you've got a really clear idea of the stability in terms of the context that you are working in, and actually where and at what point those potential changes might have happened. And during that process evaluation, the key thing and the key place to start is to describe your intervention, your innovation, your new process, the new model of care, the new patient, the new workforce role you might be implementing, whatever that might look like. So really put some time to making sure you're really understanding what it is you're putting in place, and how that might disrupt or influence or enhance the system, the pathway, whatever that might look like. you have your period of implementation where you're actively putting in place your innovation, you're getting people to use it, your new workforce role might start, you might have this new pathway. That's that time period where that's happening. And what you want to understand as a result of doing that implementation, you want to understand what has been put in place, what mechanisms have occurred during that implementation that has resulted in the intervention being impactful. So this is where it's often, this is the part where you start to understand what the barriers and facilitators to an intervention are, the key things that have made things successful. This might be understanding, things like what we might call fidelity. So how well have people taken it up and used something as intended? So you might measure lots of different things within a process evaluation in order to really understand kind of, how well this could be, say, for example, scaled and spread. What might people need to learn from you doing what could people learn from you doing a process evaluation in order to maybe not experience those same pitfalls, or they might be able to do it more efficiently or more effectively going forward. So a process of evaluation is really valuable in terms of learning. There's a few ways you might collect data during a process evaluation, and they're just illustrated across the top. So you might do some observation. You might be seeing how people are working, what changes in practice are happening. You might be collecting things like when you're observing, like time taken to conduct new processes, for example. So there's the potential to observe people. Again, you might interview people to understand what you might have expected to see, and if something didn't happen, why weren't, for example, people using the innovation? Why did it sit on a shelf? What were the things that meant that they didn't pick it up and start to just embed it into their usual day-to-day practice, for example? You might do a review of notes or a review of documents to understand that process of implementation, for example, or you might do a survey. So that's just a few of the methods that you might apply during a process evaluation. And one of the things at the bottom of the screen I've just highlighted is quite often process evaluations are underpinned by some kind of theoretical framework. These are just two that have been picked out. For example, you might underpin a process evaluation with something like normalization process theory, which is an implementation theory, which is helping to understand that process. And again, you might, if what you're implementing is intending to achieve some kind of behavior change, some kind of change in practice, it might be more appropriate to underpin a process evaluation with a behavior change theory. And one of those, which a lot of people are familiar with, is the COMBI. So that's the one that I've illustrated here. There are heaps and heaps of frameworks and theories that exist, and it's essentially picking the appropriate theory that fits the project that you're intending to do. Next slide, please, Vivi. So the last part that I just wanted to talk through is economic evaluation. So is it worth it? So if you're making a financial commitment to procure something, you need to know whether that financial commitment is actually going to be something that adds value to the patients, to the staff, whomever it's intended to add value to. So in terms of economic evaluations, on the screen where you'll see where it says more costly, less costly, more effective, less effective, this is what we call we call this a plane, essentially. And what we have is 4 quadrants. And what we do when we're evaluating an innovation from a health economics perspective is we want to understand, obviously, the cost. So is something more expensive or less expensive? But this is connected to something being more effective and less effective. So I guess the health economist in the West of England team has used this term a few times, but the unicorn. So if something is more effective and less costly, so in the box where it's got the tick, that's essentially the no-brainer innovation. the no-brainer intervention, the no-brainer change to a model of care. If it's more effective and it costs less money, why would we not do it? That would be the question you're asking there. Again, if you look at the inverse of that, if something's more costly and less effective, there is the argument of why would you do it? If it costs more money and it's not giving better, you're not get better outcomes, you're not going to spend more money on that. The question always comes in, and this is where a lot of the innovations tend to sit, is in the other two quadrants. So if something's more costly and more effective, you might want to do it because you're going to get better patient outcomes. It's a consideration then of whether you then it's worth it, and the system has the finance to be able to procure that more expensive thing. You'll see it's quite faint, and I apologize. Down the middle of that graph, there's sort of a diagonal dotted line, and essentially the closer to that line that we get in terms of between the more effective and kind of less costly part of that upper right quadrant is when we think you probably will do it. If it gets towards the more costly, even if it is more effective, that's where you're starting to think about, is the cost worth the investment? And then the bottom right is if it costs less but it's less effective, it's a big query, because are you going to spend less money but actually have poorer outcomes, maybe less effective care, for example? So I hope that makes sense, just to orientate you to that kind of cost effectiveness plane. But essentially, when we think about economics and we think about when we're thinking about the economics of an innovation or a intervention, we're thinking about it kind of with those four quadrants in mind. And then the other thing on the other part of this slide to orientate you to is there's different types of health economic analysis that we could do. And again, this is where we have to be considered and be a bit deliberative about what it is we want to do. So we have what's called we can do what's called cost effectiveness analysis, which is, for example, NICE's main focus. They're interested in cost effectiveness analysis. At the other end of the spectrum, we have costed pathways, budget impact models, cost benefit analysis, which tend to be more when commissioners are more focused. So the kind of the budget impact models, cost benefit analysis is essentially money against money, whereas cost effectiveness analysis takes into account we use measures which help us look at quality adjusted life years and kind of the benefits of that against kind of, and it helps us plan for like longer term, whereas that's not necessarily what we might do. Most of the work that we do is return on investment and cost benefit analysis work. And then there's something in the middle that we call cost consequence analysis, which is somewhere between cost effectiveness and kind of money against money, essentially, which is taking the finances, how much something costs against the benefits, and then looking at that on that set of scales. So we might choose to do different types of analysis when we're thinking about health economics. So Vivi, next slide, please. That is, I've whizzed through that. That is the end of the slide. So we've got plenty of time for Q&A. Kate, if you're still here, I don't know whether you want to do your slide in terms of the innovator support, and then we could just open it to Q&A for the remainder of the session, if that would be helpful.
That would be great. Thank you.
Yeah. Vivi, if you skip on a couple of slides, there is a slide towards the end of the slide deck.
Yes.
Not the next one. We'll come back to this slide, and we'll come back to this slide. The last one, Vivi. Yeah, this one.
Thank you. So hello, I'm Kate Phillips. I'm a programme manager working with Ruth, Health Innovation West of England. And the team that I work in, we support the development of innovations and the adoption of innovations in healthcare. So we work very closely with Ruth and her team. And we support the development and adoption of innovations in a variety of ways, which some of you on this call may have already been involved with. But as a starting point, it's really, we have a one-to-one and we learn about someone's innovation journey, and then we can match our support and resources to help them on their way with innovating in healthcare. So I won't go through the details on this slide, but just to highlight that we work with lots of different people in the health and care system, and we run things like events, and we have opportunities to connect and network. We provide updates on funding opportunities, and we have a whole host of resources on our web pages, which are called the Innovation Exchange. So you can access the Innovation Exchange web pages through our main Health Innovation West of England web page, or you can scan our QR code on the web page here on the slide. And I particularly draw your attention to our case studies, which kind of really demonstrate and bring this slide to life in terms of the way that we work with innovators in the West of England. And on the slide there is also our direct email to the team, which you can get in touch with us if you have any questions about the resources or the way we work. So I will leave it there. But thank you so much, Ruth,